Well, today I think we're going to start talking a little bit about the benefits of what we call healthcare, simple self-care, and how the unhealed healers sometimes don't do the very things that they teach.
A lot of times I've seen therapists, counselors, people especially working in a large community such as a hospital tend to get into the job as a way of healing rather than their own support system individually. So as long as they're working, they do fine. When they have to go off on their own and they no longer work there, most of them have a pretty difficult time. So that's kind of a pattern I've seen.
You know, I've seen that pattern and I've seen another pattern. While they're working, sometimes, and you know, any organization has management problems, their personalities, and their problems start surfacing at work. And so they're basically duplicating their family system roles when they were children, and it causes all kinds of havoc at work. And so they don't know how to, they don't know how to take care of themselves.
Right.
Let's take somebody that's a real worker, and everybody likes a worker bee. The only problem is if the manager is expecting more and more and the worker is working more and more, there's no ability for him to self-regulate his work.
Mm-hmm.
And pretty soon he develops health problems. And then, or he'll get mad at the other employees because they're not working nearly as hard as he is, and he thinks that, he gets resentful. That's just one example of the many problems that can happen in, any kind of situation where people don't have a program for themselves.
So the bottom line, anyone getting in this field should already have a support system in place prior to getting into the field. Even if they don't have 12 steps to support them, they don't belong to any support groups, the 12-step groups. There's many people that have gotten in as normies, whatever you want to call it, that aren't addicts, that aren't alcoholics, that have no real mental health issues, that still need support because it's such a high energy, drama-filled work setting. When you work with people with chemical dependency and dual diagnosis, you just have to have that kind of support. With even a therapist, if you're a normie, quote normie, would be a very good idea. Things are going to come up. All of us have childhoods that have some rocky road in it, and it starts, that high pressure starts eroding and bringing up some of the drama that may have been stuffed in the subconscious or lower levels. So yes, we do need support for all people in the career field.
And I totally agree. And the other thing that I think is kind of, people don't, either when they're in training, nobody brings this up, or they bring it up as a casual by the way. But if healers are supposed to be helping people, and they themselves are unhealed, they're kind of spreading their disease by example.
Absolutely.
Not even just, and the other thing is some people, with the kind of the erosion of our family systems and our culture, it used to be you'd have your church, they supported you in your family unit, and generations of families in small, maybe farming towns or something,
Yeah.
They were connected. With our mobile society, there's actually a disintegration that's happening. And
Yes.
even though it seems like with the internet we're connected, we're really not connected.
Not face to face. It's much more impersonal. People can get away with not having to see themselves and how they act when their face or voice is the only thing across a 100-mile gap in a line on a computer screen. There isn't that personal touch. You don't feel the energy of the other person. And I think that's really important to have that kind of contact.
I agree. And the other thing that one of the things that I've seen a lot of, and we can continue on the problem, but we want to get to the solution.
Sure.
Is as that erosion fills and as people have the need for contact. For example, there's a huge thing happening here in California for doulas because the mothers are not around. There's no mothers that can give their children, who are now becoming mothers,
Yes.
the close personal care that's really needed. That would be an example of how things are evolving.
So it goes back again to the family system. So anyone in a chemical dependency field needs to have a strong background in family, because those are hand in hand. I mean, there really is no difference. So the solution would be that, like, as a doula, other people in life also need these artificial props. Like, a lot of family systems don't have a father present or a mother, and the doula works with the baby, and you can really see that. Works with a pregnant woman and the child as it comes, giving that nurturing of a grandmother and a mother.
Yes.
So other people need that same type of support
Yes.
when they don't have a parent that's been in their family. So
Absolutely.
I just see this as being a field that needs each counselor, each therapist, people working in the field must have a support system and be using it.
And also, I think they need a mentor. They need a mentor because, and it doesn't need to be in the system. It might need to be out of the system because they're kind of more free to give their help.
Yes.
One of the things also is, you know, like obviously exercise, nutrition, and things like that. You know, relaxation. You know, it's one thing to say to do that. It's another thing to actually, you know, have an exercise program where you're accountable to somebody.
So I think in summarizing, people need a therapist possibly. They need to watch their body and their health, their diet, exercise. They need to keep an eye on themselves along with helping these others at the same level. If you haven't experienced it, there's really not too powerful of a way you can give it away as a therapist. So to sum it up, we need to take care of ourselves better than we do even the people we're working with.
Oh yes, absolutely.
Yes.
Okay, that's it.
Summarize.